At the top this evening, fake prescriptions. Tonight, an Hidalgo County woman awaits her trial.
Samantha Amelia Caratachea was arrested last August. She's charged with 3 counts of getting controlled substances by using fraudulent prescriptions. Her pretrial and trial date is set for July 7th. We wanted to know just how easy it is to use fake prescriptions to get drugs.
Yeah, Channel 5's Taylor Winkle went to a Valley pharmacy today, and she learned what they're doing to keep those drugs off the streets. Taylor?
Today we learned every pharmacy is required by the state of Texas to report prescriptions for controlled substances they filled that week. Controlled substances are usually classified as the ones that help you manage pain. The government typically regulates them, and they're typically the most likely to be abused. With so much out there,
that's our main job as pharmacists, is to protect the public, and so that's what we're really trying to do all the time.
It's no wonder so many drugs fall into the wrong hands. Dr. Michael Muniz at Muniz Rio Grande Pharmacy is trying to stop that.
We're doing a lot that we can. I mean, it's, you know, I think of it as if this medication's out there, I mean, can my kids get access to it? And what kind of damage it will do.
He says pharmacies can help cut back on the problem by getting personal with their patients. Here, pharmacists tell us instead of filling every prescription that walks through the door, they look into how legitimate they really are. They've seen cases like the one sent to trial today firsthand.
We had a patient one time bring in a prescription from Houston that was seeing a doctor up there. We ran him through the system. We looked on the State Board of Pharmacy and even on the medical board to make sure that the doctor was registered as a pain management clinic, and they weren't, and so that was a flag for us that this didn't seem right.
Every pharmacy is now required by the Texas State Board of Pharmacy to report prescriptions they filled for controlled substances within a week. Here they submit their reports every day. Reporting more often means pharmacists will quickly see what their patients are doing at other pharmacies.
With our system,
Dr. Muniz showed us what the system looks like.
When a patient brings in a fraudulent prescription, we can detect it pretty quickly because we know what systems the doctors are using.
He says when he does spot fraud, it gets reported immediately. That way they can help protect the public. Of the more than 33,000 opioid-related deaths reported in 2015, 1,186 of them were in the state of Texas. Now, we don't know how many of those deaths were due to prescription abuse of some kind. We do know that misuse of prescription drugs is the leading cause of overdose deaths. Reporting live in the studio, Taylor Winkle, Channel 5 News at 6.
In May, Texas received a $27.4 million grant to combat opioid addiction. That's according to the Department of Health and Human Services. The money will be used on prevention, outreach, and treatment programs for vulnerable groups, and that includes our veterans and people being treated for chronic pain.